Yeah. Good afternoon, everyone. I'm Dr. Ankita Pandey. I'm working as an ICU registrar in SL Raheja Hospital Fortis Associate. Today, I have the Director of Critical Care, Dr. Sanjeev Sansitharan, who's a professor of critical care and also the President of Indian Society of Parenteral Nutrition, and currently my mentor, which I'm really grateful for. So, today we have him here to give us an idea and a brief idea and knowledge about monsoon illnesses. Thank you, sir, for giving us so much time to us. And I hope this is very beneficial for the layman people and even the public because monsoons are a very big part of Mumbai. And normally, when we travel, we hear people coughing, having a cold. So, we really need a knowledge about what are the monsoon illnesses we see in Mumbai in specific and gain knowledge and insight about them. So I would start with the question, what are the different and various monsoon illnesses that we see in Mumbai today currently?
Thank you, Dr. Ankita, for inviting me for this Facebook Live. And let's hope that this turns out to be a fruitful discussion in the first place. So, yes, with monsoon, is a large amount of showers that comes, and it's important that monsoon comes with it only joy and showers and not illnesses. Usually, what happens is with monsoon in our city, we actually have a large amount of shower of diseases too, and those diseases that we have are can be actually counted on your fingers. So the four main diseases that occur in monsoons range from hepatitis A, dengue fever, malaria, leptospirosis. But all said and done, there is a fifth disease that also is seen very regularly, and that is H1N1, swine flu or the respiratory illnesses. So these are the five major diseases that would actually affect individuals during monsoon, and it spoils all the fun and joy of the beautiful rains that our country gets.
So any disease among these that we should be worried about in specific?
So, if you ask me, am I going to be worried about any disease? No, I'm going to be worried about every disease because most of these diseases that we have, including hepatitis, malaria, lepto, H1N1, all of these diseases can turn wrong and turn severe very quickly. They are not diseases like cancer, which comes and then slowly progresses. They're not chronic diseases like diabetes, which slowly progresses. They're not a heart ailment that again failure type is slowly going to get better. These are diseases that can come and can become acute and severe very quickly. And when they get severe very quickly, then the chances of survival in such cases becomes low, knowing fully well that there is treatment available for these things. There is treatment available for these things. And importantly, because it's a preventable disease, it becomes even more important for us to understand that all these diseases can actually be completely preventive. And we know from school days, we say prevention is better than cure. These are those diseases can be prevented. So if you ask me, is there a single disease I'm worried about? No, I'm worried about the entire range of monsoon illnesses.
Thank you, sir, for that input. When we do get such diseases like dengue and malaria is like very common in India, which we have been seeing since generations and years. Many times, most of our family members or even neighbors, they would go for home remedies first and then think of really going to the hospital. So, what kind of patients should we be worried about who should be getting admitted in the hospital versus doing home remedies?
Yeah, Dr. Ankita, very important question. Which of those patients can actually be left at home and which of these patients can be brought to the hospital, isn't it? So before we go into the warning symptoms, there are three category of patients that cannot be treated at home if there is a monsoon disease. One is the infant. Any infant, young, small baby or less than 1 year of age, that patient cannot be treated at home. If he has monsoon illnesses, that person should be in the hospital. The second is the pregnant lady. A pregnant lady cannot be treated at any given moment with a monsoon illness at home. Remember, there are two lives at stake, and the physiology in pregnancy is very different. And that is the reason that we need to ensure that pregnant females or seek medical help as quickly as possible. And the third category of patients that will actually require hospitalization for that matter is those patients who are immunocompromised. Now, this word immunocompromised is a very heavy word, and what it means is those patients who are on transplants, those patients who have undergone kidney and liver transplants, those patients who have long-standing and very brittle diabetes, those patients who are on cancer chemotherapy, those patients who are on immunosuppression for autoimmune disorders. So these are those patients that can't be managed at home. Another category of patients that we are now, since COVID has come, we are aware is the elderly group. So anyone above the age of 55 um, is someone who will probably you will have to be very careful of and have a very low threshold to admit into the hospital. So all said and done, you have a monsoon illness. This is a monsoon illness. These are the category of patients that you should never and never treat at home. That will require hospital help, medical help, and quick treatment. Especially because there is treatment for majority of these illnesses, and they need to be monitored much better than otherwise.
Correct. So coming to, as you said, these are the categories of patients. Now, I think one question that we all have is that when we get a fever, how long the fever should last for normally? Basically, what are the warning signs that as a person at home who's been diagnosed maybe for dengue, malaria, or H1N1, what are those warning signs where we should know that, okay, can I recover at home or should I go to the hospital and get admission?
Yeah, so it's a very, very interesting question that you asked. Where is the time that I should basically seek hospital help? This is, I think, what you're asking me, isn't it? When
Yes,
should I go to
yes.
the hospital? So remember this: every patient that is there infected with monsoon illnesses will present largely the very similar way. Everyone is going to look the same. Okay, they will all have a fever. Many of them, 30 to 40% of them will have a rash, and many of them are going to have body aches and joint pains. Because does this mean that all these patients come to the hospital? No, 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 not really. If the patient has got a few signs and symptoms which we'll elaborate now, these patients cannot be managed at home, of which a very simple symptom that you can see is redness of the eye. When there is redness of the eye, this is called as conjunctival suffusion. Now, if you conjunctival suffusion means there is redness all on the white part of your eye. This is called as conjunctival suffusion. So when you have conjunctival suffusion, this is usually meaning that you have certain diseases that have bleeding tendencies, of which one of the disease that we're worried of is leptospirosis. So let's take a combination of a person who's bathed in the water and then has had conjunctival suffusion with a fever. That patient should not be treated at home because there is a very high possibility that this patient gets severe leptospirosis, which will actually require you to be in the hospital. The other thing is if you have intractable vomiting. See, sometimes what does happen is that most of these viral illnesses may also affect the liver. So when they affect the liver, there is the situation that the liver will start paining you. That is, the right upper region of your abdomen will start paining you. When the right upper region of the abdomen pains you, you might also develop intractable vomiting. In the event that you have intractable vomiting, it is very important for us to actually take hospital help because of the reason that with intractable vomiting, you might get extremely dehydrated. And if you cannot consume actual amount of water, the amount of water that you're losing, you will get dehydrated. And when dehydration comes in, that is when various other organs fail, like kidney and things like that. The third reason why you would get admitted to the hospital is when you are yellow. So once you become yellow, that is all over your body, you get become yellow. The palms become yellow, the eye becomes yellow. The mucosa, that is the tongue and the mouth becomes yellow. This is an indication of jaundice. Jaundice means your liver is not functioning well. If a liver is not functioning well, it could be any of the monsoon-related illnesses that is causing your liver to dysfunction. At such stages, it's very important to be monitored very carefully. The other reason that you would need hospital help immediately is when you start bleeding. So some of these patients would bleed suddenly. That means they would start bleeding from their gums. They would have motions that are turning black. Sometimes there'd be a vomiting of blood. Sometimes there would be bleeding spontaneously in the elbow joint or joints or somewhere anywhere in your body. A blackish discoloration that is seen in your body. When anything like that occurs, or easy bruisability, if anything like this occurs, it's very important that you seek hospital help because this might indicate a deficiency of the coagulation system that is responsible for keeping your blood flowing properly. It may also indicate the drop in platelet counts, which is classically seen in cases like dengue fever and malaria. It's very classically seen in these cases. So this is the other reason. The other reason that you would need to get admitted is if your urine becomes eye colored. A very simple thing that you can do at home. When you're at home and you are actually passing urine and you find that the urine is eye colored, this is the time that you should seek hospital help. High colored urine can mean a lot of things, which include right from the fact that your hydration is not okay, up to the fact that you are developing jaundice, or worse, you might be developing bleeding into your urinary tract. If anything like that is occurring and the change in the color of the urine occurs, it's very essential that you come to the hospital. The other thing that you might notice is I was passing good amount of urine yesterday. Today my urine output has actually come down. So this is the time that I will seek hospital help, because once urine output is coming down, remember your kidney is taking a hit. It is very important for you to seek hospital help at this time. Another simple thing that occurs is a headache. Now, whenever you have a headache, when you have a severe headache, a headache that you have never had, something the worst headache of your life, something like that, associated with a pain behind your eye. In medical terms, this is called as retroorbital pain. When you have retroorbital pain with a intractable headache, it might be something that we call as meningitis or encephalitis or the start of a severe leptospirosis. So when you have a very severe headache with a retroorbital pain or pain behind your eyes, it's very important to seek hospital help. Remember this: if you have fevers that are coming, then it is subsiding with extreme amount of sweating, then becoming okay, then again having fever, again having chills, again having sweating, then again subsiding. This is classical for cases like malaria. And in malaria, why do you need to go to the hospital? You need to go to the hospital because there is one kind of malaria that turns severe very quickly, and that is called falciparum malaria. Unless we diagnose this as falciparum malaria, we will not treat. And remember this: the faster you treat these patients with anti-malarial drugs, the quicker they recover and the less severe they become. So the moment you get fever with chills in this season, particularly in the monsoon illnesses, in the monsoon season, it is important to get yourself tested. And to get yourself tested, it is easier to go to the hospital, let a doctor see you, check whether this is malaria, and immediately start your medicines. Remember this: we still have very good medicines when it comes to malaria, and that is the reason that we should seek hospital help as quickly as possible. Yeah.
Thank you, sir. You have wrapped it up really well regarding these, because I'm sure, as a normal person, as you said, a headache may come and go. So this was a very nice brief session that you gave us on like how to really think about every little symptom that you get, which may be very important, and when you should seek hospitalization. Now, coming to that part, I think a lot of people in general, when they know that the fever is lasting, that they have to go to the hospital, they have a fear whether they're going to be kept in the ICU versus the wards. So, coming to that picture, what happens when you come as a patient to the hospital and you get admitted?
All right. So when you come to the hospital, we doctors and nurses and the healthcare staff are geared to take care of you. So the first thing that we do in such cases is usually assess your severity. If you are so severe that your blood pressure and your vitals are unstable, when I say vitals, it means blood pressure, pulse, and whether you are fully conscious and obeying commands. If you are not fully conscious, you are not okay, your blood pressure is low, your urine output is low, you will be shifted to the ICU, because this is something that will require intense and close monitoring. However, if you are otherwise stable, such patients will go to the wards, and when they go to the wards, what we do is that we assess the dehydration and we treat it. Remember this: most of the monsoon illnesses are supportive care. There is only one illness in which there is treatment, two illnesses for that matter. One is leptospirosis and the other is malaria. There are only two illnesses which has got a medicine, whereas the rest is supportive care. When I say supportive care, this can't be done at home. Supportive care is done in the intensive care unit or in the wards, where we actually support the vital parameters. We are supporting the vital parameters so that you don't develop complications. How does a person develop complication? When these vital parameters are not supported. That means if the blood pressure goes low, pulse rate goes fast, patient gets jaundiced, and you don't take care of this very well, then this patient goes into multi-organ dysfunction syndrome. Unfortunately, one out of every four patient goes into multi-system organ failure, and the reasons why they go into multi-system organ failure is that they don't take hospital help quickly. It's important to come to the hospital and take the help of a doctor as quickly as possible, because it will prevent multi-system organ failure. It's very important that whoever is listening on to this understand this, that monsoon illnesses is something can be treated very easily provided you take help quickly.
Thank you, sir. Coming to a very common question. I think it's very famous, this kind of remedy amongst the general population, which, sir, even in my experience, I have seen is called papaya leaves in dengue. Papaya leaves or papaya leaf juice, there are tablets. So I think a lot of patients are already on it or would be like on it while the medical treatment is on. So what is your view on it exactly? Whether it really helps with the platelets or should patients really take it, especially the elderly who are into Ayurvedic treatment. So what is your view on the papaya leaves?
All right. So this is a very difficult question to answer. A, because of the fact that this is so commonly used all across. Even in allopathic medicine, we have many doctors prescribing the papaya leaves, which is available as capsules, available as syrups, or they even make it at home to drink, and they say that that actually improves. But what you must understand is what happens in dengue fever. So in dengue fever, what is going to happen is initially you're going to have a fever, and then because of dengue fever, your platelets are going to go down. Okay, so it goes down variously. For example, if you have severe dengue, the platelets will go down further down. Okay, it might go down, and this occurs till day 4 and day 5. After day 4 and day 5, slowly and steadily the platelets are going to rise. So at day 6 and day 7, you are going to see the platelets that are going to rise. Okay, so it's not that this is the usual manifestation of any dengue fever. Usual clinical manifestation is platelets will first go down at day 3 and day 4, and after day 3 and day 4, it will start slowly rising and reaching at day 7. Coming to whether papaya leaves will work. See, there have been studies that have been done in with patients of dengue fever where they've given papaya extract, papaya tablets, and things like that. And even reputed journals have actually published these articles. But what you must understand is the timing as to when it is given. So if you are given the papaya leaf extract at day 1 and you see the platelets not coming down at all, that would clearly indicate that papaya leaves does something to the patient. But what is usually seen in most of the studies is the fact that papaya leaf extract is given at day 3, day 4, when we have noticed that the platelet count has gone low. Now, what is going to happen once it has gone low? In next 2 or 3 days' time, the platelets are going to go on top. So there is an association at the timing of giving that papaya leaf extract and the rise of platelet count. Remember this: we are, as doctors, we would love to give natural remedies if by any chance we can improve things like this. There are so many other diseases where we want to get the platelets up. For example, ITP. People have something called idiopathic thrombocytopenic purpura. Okay, that is again a problem where antibodies are there and the platelets are on the lower side. We also have diseases like malignancy. In malignancy, the platelets are on the lower side. Okay, and we want to get the platelets to go up. There are so many diseases. Sometimes people have got large spleen. When they have large spleen, the platelets are on the lower side. When their livers are not functioning well, the platelets on the lower side. If papaya leaf extract could have worked in dengue fever, it could have worked in all of these other diseases, isn't it? It makes clear sense that logically that if I use papaya leaf for dengue fever, we could have used it for the rest of the diseases also. But there is not a single society that will actually advocate the use of papaya leaf extract for improving all these rest of these conditions, not even dengue fever. So as of now, there is no review that actually says or no guidelines across societies that say papaya leaf might work. There are a lot of anecdotal evidences. For example, your neighbor might tell you, I took papaya leaf and next day my platelets went up. There are a lot of anecdotal evidences that come with papaya leaf extract. I don't see a reason that it will cause any harm per se, but at the moment, there is no evidence to state that this papaya leaf extract will increase your platelet count in any way. So if somebody is taking papaya leaf extract and he is strongly believing in that, I would say, okay, you give it. But personally, I would not recommend papaya leaf extract because it doesn't do any good to your patient. Rather, have an extra glass of water or get admitted to the hospital for dehydration. That would be a better option rather than actually popping papaya pills. And that is one of the biggest problems that occurs. Person sits at home, does a laboratory investigation. Now, with the advent of COVID, people have all realized to take WhatsApp consults on phone. And then they take a consult on the phone, they do a laboratory investigation, dengue comes positive, and then subsequently they find the platelet count to be 70,000 and or 1 lakh or less than 1 lakh. They take papaya leaf at home and they hope that that is going to come on top, but they don't really follow up that platelet count again. And needless to say, the platelets will go down, and that is those 1 in 4 patients. Remember this: 1 in 4 patients that will go worse and then come into the hospital. So 3 of those patients will do well. That doesn't mean papaya leaf has worked. It just means that person has improved because of good supportive management. But otherwise, that one person who goes down, will not is not going to improve with papaya leaves. That is the entire situation. Okay, I'm not meaning that it does. I do not know whether it works. The answer is we don't have evidence to say that it works. Okay, so I
Yes.
put it this way. Let's not use it anymore. This is what I feel.
So I hope sir, exactly what sir is trying to say, if I'm not summarizing it wrong, sir, that you can go ahead with the papaya leaves, but it's very important to also look at the warning signs and know that you do need an admission and you need treatment, because there is treatment available. So it's always better to also seek medical help, because that is what is going to really help you at the end. And I hope the general public gets a sense of that, as you said, that just papaya leaves may not help you. And if you're in dehydration state, it's always better to seek some sort of medical advice.
Correct.
Uh,
Correct.
Also, sir, I think another very important question, when the monsoons are there, a lot of people do end up eating outside. So they might wonder if there are any foods in particular that they should avoid during this season for tropical illnesses.
Yeah, so as I said, prevention is better than cure in such cases. So if you want to avoid a monsoon illness, it's very important to stop eating from outside street food. This is something that you should avoid completely during monsoon season. Street food is something that you will not take when you are in monsoon. Otherwise, you will probably get some kind of disease. There is a very high chance of getting all that. The second thing is, remember these mosquitoes, the Aedes aegypti mosquito, which is responsible for the bite causing dengue, and the Anopheles mosquito that actually causes malaria. I've got a peculiar thing. The Aedes bites in the morning and the Anopheles bites in the evening. This is what happens. So during twilight, it's important that if you want to go out or venture into the wilderness or go out of a house, it's better to wear full sleeve clothing and preventing the bite of this mosquito. Mosquito repellents, using all these things, closing down the doors of your house. These are things that you should do in order to prevent a mosquito bite. So prevention is always better than cure. Coming to the topic of what I should eat if I have a monsoon related illness, then it is important that you avoid spicy and oily food. These trans fats would actually cause the digestion to become very difficult. And here you must remember the liver is actually taking a toss. It is actually playing havoc with your liver. So this is the time when spicy food should be kind of avoided. The answer to getting a good diet is always water, 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 and more water. So as far as possible, drink a good amount of water throughout the day. Simple bland diet like oats porridge, wheat, rice, curds. These are something that we can probably use during this time. A bland diet is what is prescribed in such cases. But usually, what happens in such cases is the fact that they do get anorexic. They can't eat well. Since they can't eat well and they are having vomiting, this is that patient that actually should be shifted to the hospital, because he will require supportive care. So diet has to be bland, it has to be nutritious, but it cannot be heavy in trans fats. It's very important that it's not heavy in trans fats. Um, some people also develop a stomach upset in such cases. When they do have stomach upset, they pass huge amount of motions. Remember this: if you pass more than 4 motions in a day, and you get tired and weak, and you can't even lift up your head and you can't sit up upright, this is the time you need to come to the hospital. Don't try doing dietary alterations just because you have diarrhea. This is the time you need to come to the hospital. Okay.
Okay. So water is very important, and I think also everyone is aware. Even electrol has become a very big hit since COVID. So hydration, as you said, is a very important key. Coming to our last question, sir. A lot of elderly, not just elderly, in fact, I think after COVID, a lot of flu vaccines have come out. So, are there any kind of precautions, or do you feel any kind of vaccines that we can take against monsoon illnesses?
Yeah, so in the monsoon, we normally talk of the big four or big five diseases: lepto, malaria, dengue. But you must remember there are two, three more diseases that are also very prevalent during the monsoon illnesses. And of that, respiratory tract infections are very prevalent in monsoon, which includes H1N1, viral infections, influenza, and also pneumococcal infections. You will be surprised that in the monsoon season we have more amount of respiratory tract infections that are there admitting to the hospital per se. One of the simple things that elderly immunocompromised individuals can do is take vaccination. Vaccine is the best medicine that you can ever have to prevent an illness, and of which there are few vaccinations that can be advised to immunocompromised diabetic and elderlies, of which one is the influenza vaccine. The influenza vaccine is a vaccine that is taken once in the year, and it is taken when the strain changes. So you must ask your medical store or your doctor whether the strain has changed and take it at that particular time of the time. So this is the time when the new strain comes out. This is when we're talking now. This is the time when the new strain of influenza vaccination comes out. Taking that once in the year is very beneficial for elderly patients who are immunocompromised, or those individuals who are actually immunocompromised because of pharmacotherapy that we give them. The other vaccination that can be done is a pneumococcal vaccination. It's called Prevenar 13, which is widely used. Even pneumococcal pneumo 23 is widely used. This vaccine also can be given, which will prevent simple diseases like streptococcus pneumonia and pneumonia lower respiratory tract infections. Now, if you ask me whether lepto, dengue, and malaria have got vaccination, no. Malaria and dengue fever have got vaccination that are being extensively used in Africa. However, that has not come into India as of now. The malaria, the RTS 332 vaccine is a very good vaccine that is being trialed and tested and actually is proven to be effective, which is being used in Africa, but they're for babies. It's for babies over there. Whereas a dengue vaccine, which is being used again in those regions, are also for children who have been already exposed to dengue in the past. They have been also getting this dengue fever, and it has been used extensively and proven its efficacy in regions in sub-Saharan Africa, Nigeria, Kenya, and all these places. Very soon, we should see it coming into India too. These vaccinations, and this will be a boon to a large number of people in our country too.
Okay, so also just one question. I'm sure there's a huge population who's had dengue, malaria, or even H1N1 currently right now. It's very common. So once you're infected with these illnesses, after how long should we take the vaccine if we want to?
For these, for H1N1 and all these things.
H1N1,
So
yeah.
so let me explain to you. If the vaccination is for H1N1, see, the
Yeah.
first thing is we say that let's not take the vaccine immediately, because what happens is, how does a vaccine work? Normally a vaccine works that once you give the vaccine, it creates an antibody, it creates a response. Now if the person is weak to begin with, if the person is weak to begin with because of the illness that is happening right now, if you were to give the vaccination, it will not create the response that you want to create. So that is one thing that will happen. It will not create the response that you want to create. So the vaccination may not give the efficacy that is desired. First thing. Second thing is, sometimes vaccinations do cause muscle soreness. They cause fever. Some of these vaccinations may cause mild symptoms. Now you might mistake those mild symptoms of vaccination to the disease itself, which is already going on. So that is the reason that we say, let us not take the vaccination during the disease state. Wait for around 2 to 3 weeks, after which the vaccination can be taken. So I would recommend it to be taken 2 or 3 weeks after the state has gone past and it is abated, so that the vaccination does not confound the problems that vaccination itself shows.
Okay. Thank you, sir. Uh, so anything you want to add in the end before I summarize our live session, sir?
Yeah, so I would put it this way, that let monsoon be a joyful season for everyone, and it's very important that we can enjoy the rains and not enjoy the diseases that come along with the rain. So it's very important for us to enjoy the monsoon season, but take preventive measures, ensure that you don't get sick, and if you get sick, please don't delay hospital admission. Seek medical help as quickly as possible, because we have got disease, we have got the required equipment and medicines to actually cure many of these diseases and prevent complications.
Thank you so much, sir, for giving us your prestigious time. It was really nice having this live session with you, and I really hope that as a team we have really answered one of the most common questions that normal general public has. We really hope that we make a difference also in your decision making. And as sir said, do enjoy monsoons, but at the same time, prevention is always better. So do whatever questions, if anyone has, anytime can reach out to us also. And I would like to conclude this live session. Thank you everyone for joining us.
Thank you very much. Thank you very much.